statistics, and I know that Casey and Callie will when they're on here, so I don't want to steal their thunder, but it's staggering. I mean, close to anywhere between 1.7 to 1.9 million people are dying a year of chronic disease. We talk a lot about war. Since the dawn of this country, roughly estimated between 1.3 to 1.5 million people total have died in war, American lives. So in a year, we're losing more people to chronic disease than all the wars combined. Wow. And we're not talking about it. So to me, I was excited when they said, hey, the Senate's willing to hear, and that's the beauty of a democracy. They did let us come in there and candidly take a dump on the Senate floor on what's going on with this healthcare system and really dig into the weeds.
Did anybody try to take the side of the pharmaceutical drug industry? Did anybody question you or try to push back?
So prior, you do a debrief. So we did do a roundtable prior to going into the communal roundtable in front of the public eye, which they had no idea what was coming. The Senate didn't expect it. We had assembled a grassroots effort to get the word out there, and over 2,000 people took off from work. This is a Senate hearing. Over 2,000 hardworking Americans took time from their busy day, flew to D.C., had to sit in an overflow room to listen to these testimonies. And the level of feedback from people, from like real humans, real world people, was staggering. I mean, people afterwards came up in tears sharing their story of how the system had let them down or a loved one down, misdiagnoses, like all the different issues that they've dealt with trying to navigate this system. And to the senator's credit, you know, behind closed doors, they did say you probably don't want to go ultra hard after the food industry or ultra hard after the pharmaceutical industry because it may limit our ability to get things done. But they did.
How do they phrase that?
They just said you catch more flies with honey than you do vinegar. And, you know, me, Callie, and the other folks that sat on this panel, you know, our goal was to just share our stories and share what we saw. And so my testimony in particular was really more about the human side. You know, there's so many staggering datas and statistics and numbers, but behind all that is a person. Like, that's all I wanted people to understand. These are human lives. You know, when Jelly Roll testified, I think he said this equivalent to a 747 jet worth of people die of opioids a day. And that's insane. And that all started with the lapses in the FDA and the drug regulatory market. And we know that, you know, there's an argument out there. I know Callie released the number of 50+% of the FDA's funding comes from big pharma. When it comes to drugs alone, 75% of the drug funding comes from the pharmaceutical companies themselves. And so there's a big market there. And with big pharma spending over $8 billion a year advertising,